We're back, and now let's assume that the pregnancy is continuing, and what is going to happen to mom's body. All right. First off, I just love these pictures because, here we have, you can't even tell. She's 9 weeks pregnant, barely anything's going on inside of her. But what you find is that in practicality, a lot of women by the 9th week have started to retain water and other kinds of things that are starting to thicken her waist and make it so that her regular clothing isn't fitting her as well. And she might need, she's now wearing stretchy elastic or something like that. Other women by the 9th week, you may not see any kind of signs that they're pregnant. So it really varies by person. By the 24th week, for most moms who are pregnant, this is 6 months of pregnancy. For most moms, there will be some version of a baby bump, right? It's going to be sticking out in some way. It may not be as pronounced as this picture. It may be more pronounced than this picture. One thing I want you to notice between the 9th week and the 24th week is that not only is her abdomen changing, but her breast tissue is changing as well. The milk producing lobes that we saw when we talked about, hormonal patterns and stuff, and anatomy, they're starting to get prepared to produce milk. And so they are starting to swell. They might be tender. There might be fluid that they secrete during the, this time of pregnancy up till the end. During the second trimester, this 24th week, this mom probably can feel that baby moving around in her. Usually by about the 15th week of pregnancy, women can feel movement. And it can be really imprecise because whereas this 24th week fetus is quite stuffed in there, about 15 weeks, he's still got a little bit of room. And he's small. And so he or she could be sticking an elbow out or moving a knee or a foot or rolling their head around. And it might feel more like a flutter than something deliberate at first. A lot of women report that it feels kind of like a twitchy eye feels, but it's in, your abdomen. So it's really imprecise at first. And then with, development of the fetus, it gets more and more pronounced and that quickening, that sensation that the fetus is moving becomes much more obvious. By the 40th week, which is how doctors count it, right? So now this woman is ready to deliver. For most women, there is going to be a significant abdomen. All of her internal organs have been shoved upwards. So she may have difficulty breathing. The baby's butt might be in her lungs, or the feet might be, things like that. So by the 40th week, she's getting uncomfortable. You'll notice that her breasts have significantly changed in shape and texture. They're getting ready to be able to produce milk. And so there's body changes all over. And, a lot of women think that they'll just gain weight in their abdomen, but the truth is they tend to gain all over. You'll see it in the neck and the face. You'll see it on the butt. You'll see it, sort of everywhere because the body's retaining a lot of fluid. It may not be actual fat that the mom has gained. It may just be retention of fluids. So a lot of things that dramatically change in the woman's body. The good news is all of these muscles and things were intended to deal with this, but it's a little shocking, especially for a woman her first time, how much her body really changes. So I'm going to let you guys watch this video of this fetal movement. This mom has got to be towards the end of her pregnancy, and you're going to see some very dramatic fetal movement. So I will see you on the other side of that.